One 2-year-old.
How old is she?
She's a little over 2, and she talks about acupuncture now. So
Do you think she'll be an acupuncturist?
I hope so. I'm working very hard so that way she can take it over.
That would be wonderful. I tried that. Welcome to Healthy Frontiers, a show dedicated to the education of our viewers. I'm Dr. Bizzoni. Tonight's topic is on acupuncture, and my special guest is Jillian Schwartz. Jillian is on staff at Phelps Memorial Hospital. She's a professor at Mercy College, and she specializes in infertility and acupuncture, although she also does general acupuncture. So I'd like to welcome Jillian to our show today.
Thank you, Dr. Bizzoni, for having me.
It's my pleasure. Jillian, we're going to talk about acupuncture.
Okay.
More and more people are hearing about it these days. More and more people are going to acupuncturists. Why don't you tell me a little bit about the history of acupuncture?
Absolutely. It's definitely becoming really popular. You'll see it on a lot of TV shows. Acupuncture is 3,000 years old, from China, Korea, and Japan. In this country, it didn't really become popular till the 1970s. And increasingly now, people are more aware that we treat more than just aches and pains. We treat a lot of internal disorders as well as musculoskeletal problems. And so some of the different uses are becoming more popular now.
Okay. What is the main philosophy behind acupuncture?
The main philosophy behind acupuncture is that we give the body the tools it needs to heal itself. That we're not putting anything artificial into the body, we're simply helping the body do what it's intended to do. When something has become obstructed or weak in the body, we're able to help relieve that so the body can take over on its own to make a person feel better.
Talk to me about meridians. I hear about meridians all the time, and I know somewhat of it, but give me your acupuncture slant. Tell the audience.
Absolutely. When you talk about Chinese medicine, we think a little bit differently than Western medicine, so it's important to think of things in an invisible way. So if you can picture as nerves or blood vessels run through your body, in Chinese medicine we call these pathways or meridians. They're these invisible channels that run through your body, and they're supposed to carry this invisible energy. So you can picture that as blood flowing in a vessel. In these pathways, what can happen if you were to have an injury, it's almost like getting a kink in a garden hose. So the flower at the end of the hose is not going to get watered and not function well. So you can think of that like the organs of your body. So if the hose is the meridian and the flower is the organ, and when you have a kink in it, you're not getting water there. Acupuncture can help relieve that kink and get water down the pathway to the organ, so which is going to, any blood flow improvement to an organ is going to help it function better.
So by placing, you have to find these meridians, you study to find out where these meridians are, obviously, and that's
Absolutely.
where we know where to put the needles. And
Absolutely. There's over
Okay.
300 points on the body, and there's another 300 in the external part of the ear. That's a French system of acupuncture that came later, but we use that in combination with the points on the body, and it's just a lot of memorization to find these points.
Okay, it's great to have a little chart up on the wall.
Yeah.
Once in a while. Tell me, are acupuncturists licensed?
Acupuncturists are licensed. You'll see different states will have different terms for that. Some will say they're certified, some will say they're licensed. New York State and Connecticut State are both licensed acupuncturists. And you have to, it's governed by an organization called the National Commission of Acupuncture and Oriental Medicine. And they have a website where they list all their practitioners that have licenses, which is a good place to find a practitioner if you're looking in your area. Mm-hmm. You need to pass a certain board exam and graduate from an accredited school to get a license in acupuncture.
And how many years schooling is it usually?
There's some prerequisites that you have to do. I was in school 7 years. The acupuncture program is 4 years now. I did it in 3 years year-round. So I did 4 years prior to that for a bachelor's degree.
Right.
Acupuncture training is 3 to 4 years. And
Post-college degree.
Post-college.
And then when you go to get licensed in the state, are there licensing tests that you have to pass?
There are board exams
Right.
that you will send to your state that will license you. For herbal medicine, which a lot of practitioners study in school as well, there is no licensure for that in this country. So they're working on regulating that. And that means that anybody can hang a sign and say that they're an herbalist. And that's dangerous.
How about a homeopath?
Yeah.
Does that fall into the same category?
Homeopathy is different. That's usually practiced by naturopathic doctors.
Mm-hmm.
So that's a different school. That's a different type of training. And
So naturalist, homeopath, different.
different.
Okay.
Specifically, what I practice is acupuncture and Chinese herbal medicine. So for Chinese herbal medicine, though, you do take a board exam that says you were trained, and that's something you need to look for in an herbalist to make sure that they were passing a board exam, even though there's no official license.
I understand. Okay. If I was to go to an acupuncturist, what would I be looking for? What should I be looking for when I walk in the front door? Tell me.
Well, obviously you want a clean facility.
Right.
Needles are made single-use and sterile individual packets, and that's definitely something that you should double check. You obviously, like I said, a clean facility. You want an acupuncturist that treats what you're going to them for. A lot of acupuncturists are general practitioners, but there are some acupuncturists who have chosen to specialize. So you should ask specifically before you come in about the condition that's concerning you, and be sure that your acupuncturist has some experience in that condition. If not, they can send you someone who does.
So you generally will treat different conditions, I know. You will treat stress. Talk to me some of the conditions that you might treat, someone might come to you for.
Absolutely. I mean, stress is a big one, particularly being in New York. A lot of patients under a lot of stress.
For sure.
And what often people will come to me describing will be something other than saying they have stress. They'll come up with muscle pains, fatigue, insomnia, digestive disorders. Those are really often symptoms of stress. There's some other factors that could be going on as far as diet or lifestyle, other issues that may have happened, but often they're symptoms of stress. So relaxation is one of the main things we do in a lot of treatments. But by unkinking some of those pathways in someone's body and helping their organs work better, often patients can get relief from insomnia and digestion, back pain, and that sort of thing.
So you have a general practice, but
do.
I also understand that you do a ton of work with infertility. In fact, that's a lot of your work at Phelps Hospital. You work with a lot of MDs, you work with chiropractors in that kind of situation. So talk to me about why did you get into infertility? What led you in that direction?
I started as a general practitioner, and they don't really train you in school to treat fertility patients. So through experience, I started getting a couple of patients, and I did some continuing education and saw more patients. And one thing led to another. One referral came from another person, from an MD, from different places. And that actually does make up about 80% of my practice now. I just started attracting more patients, and it was probably one of the best things that could have happened to me because I really enjoy treating this. Women often have different issues than men because they're dealing with a whole different hormone complex than men, and so their treatment becomes a little more complicated, and that's why you need someone who really specializes in working in women's health to understand that.
Just if I can interrupt you just for a second. Just so you'll treat females, but you also treat males?
I do. And I treat men in general because a lot of my female patients have a husband or a dad or someone with some back pain or some knee pain, so they'll come in. Some of the husbands are interested in doing fertility treatment as well, and I do see that, although more commonly the women are interested in coming.
Okay.
So
how does that work? Okay, so a woman comes in, I can't conceive, Joanne, what can I do, and how is this going to work on me?
Okay. Well, I'll usually get two types of situations. Either someone is trying to conceive naturally, or they're already working with a specialist to try to use in vitro fertilization or an intrauterine insemination, some procedures that help women get pregnant medically. So in either case, what I would do would be to bring some blood flow to the uterus and the ovaries. It's going to help improve egg quality. It's going to help build uterine lining up, which is helpful for when an embryo needs to implant in a woman's uterus. We'll work on their menstrual cycle and make sure that's regular. There's no such thing as normal PMS. That's not normal in Chinese medicine. Women should not have PMS. You should have a certain, confidence that your cycle is going to be regular, and we work with that. And so whether I'm working with medical doctors or with just a patient conceiving naturally, we use acupuncture, herbal medicine, dietary changes, lifestyle changes. We really work to give your body all the tools it needs to build the healthiest, happy environment in your reproductive system. And that's where our focus is.
Okay, and how do you do that? Okay, you insert a needle, right? You want to stimulate these meridians.
Right.
For fertility, though, talk to me about oxytocin and tell the audience about that.
Absolutely.
What is oxytocin?
Oxytocin is one of the hormones that helps to stimulate the uterus to contract during labor. So when my patients have become pregnant,
Right.
at about 37 weeks in their pregnancy, I'll start beginning the treatment to increase oxytocin production in their body. So this has been found through acupuncture research that certain acupuncture points can do this. We also use points to start help loosening the muscles and tendons surrounding the pelvis as a woman prepares for labor. And by doing this, often a lot of the patients who have used acupuncture will be partially dilated and have a very thin cervix, which
Right.
in labor terms is a good thing
Yes.
for a short labor,
Sure.
before they even have a first contraction.
Right.
So often these patients are going to have shorter labors. They're going to be much more relaxed because acupuncture helps with endorphin production, which is the feel-good exercise hormone.
Sure.
So often the patients in labor will have shorter time there. They'll feel some pain relief if I treat them during labor, which is what I do at Phelps.
Right.
I treat their lower back for back labor. I do a lot of relaxation points. We can do some points that will help labor keep progressing to make each contraction very effective in their labor. So women often don't experience fatigue. They usually can kind of move right through labor and have a natural birth.
When should they start with an acupuncturist if they find out they're pregnant? What's a good month that they should start to prepare? Preparation is always the key, right?
Right,
So they're ready.
absolutely. 37 weeks, it's considered full term. So
Right.
because we are working with some of the hormones, you want to make sure that everything is looking okay with the baby and the mom, and you want everything to be fully developed before you start doing that type of treatment.
Right.
You can do acupuncture treatment during pregnancy for different reasons, though. If someone were to experience nausea, if someone were to have trouble sleeping, you just need to inform your practitioner that you're pregnant. And it's perfectly safe as long as they stay away from certain points that are the ones you use for labor.
Sure. Okay. I think
Yeah.
that's great. So anybody who's having their children, definitely see an acupuncturist and see if you can get an easier delivery. Correct?
Absolutely.
Okay. Talk to me about anesthesia. We know that, at least I know that in China, acupuncture is used as for anesthetic. Talk to me about that.
It has been used in China for that. Often it requires you to hook up an electrical stimulation on the needle. In this country, it's not allowed in most places to do that. So it's been well documented that it can help with that,
Right.
but in this country, it's not generally allowed under your licensure in your state. So
Okay.
we can definitely help prepare someone for a surgery.
Right.
We can definitely help pain relief immediately after surgery.
Right.
But if someone's undergoing a procedure, that's not part of our scope right now.
I understand. Thank you. If I were to come to you for my first visit, do you take a history? Do you do a consultation? How does that work?
Well, I don't have too much paperwork when someone comes in, and I often like to bring someone right in, and I usually spend about 40 minutes talking on the first visit, trying to get a background of how people feel on a general basis.
Okay.
So I'd like to know, do you have good energy? Do you sleep well at night? How do you feel after you eat? What are you eating?
Right.
That kind of thing. So really specific questions, and just trying to get to know someone better, and then to let them ask questions.
Right.
What are your concerns? What have you heard about acupuncture? What do you ask me anything.
Sure.
Secondarily, I'll take their pulse and I'll look at their tongue. So Chinese medicine, those are two diagnostic techniques we use to find out what's going on inside the body.
Okay.
So if there's certain areas of your tongue that have a thick coating on your tongue, that's usually indicated a poor digestion.
Okay.
Some people have a red tip on their tongue. It usually means they're not sleeping well, or they have some sort of worry or agitation in their body. And in the pulse, you can feel many different things as well. Just how well each organ is doing its Chinese job in your body.
That's terrific. Do you use electric acupuncture?
I don't use it in my practice. I am trained to do it, and it's helpful for some musculoskeletal problems.
Right.
And for a couple of procedures, it can be helpful. There's something non-traditional about it to me. It's not how the medicine was created, because part of my invisible energy that's in my meridians goes into each patient that you treat. So if you're putting an electrical device on, it's a little to me like you're not following the traditional method that this was created. So I don't use it personally, but it's a generally safe technique, and there's certain things that need to be considered. If you have a pacemaker, it's not appropriate, and you just need to check that your practitioner is trained to use it.
Right. And does insurance cover acupuncture generally?
It's coming.
It's coming.
It's coming. A lot of practitioners don't deal with insurance, but they will give a patient paperwork to submit if they have out-of-network reimbursement. A lot of patients use it toward flexible spending accounts.
Oh, there you go.
So for some pre-tax dollars, it can
Great.
definitely help with that.
Sure. Okay. We're going to have a demonstration.
Okay.
We're going to demonstrate on me. Let's show the audience what an acupuncture treatment would actually look like.
So after I talk to you and would take your tongue and pulse, which we did before,
Right.
I would go ahead and start a treatment with a patient.
Okay.
So in my office, you would be laying down in a room that's generally quiet and dim with some nice music playing.
Right.
And then what I would do is to clean off a few points that I'd be using. So
Right.
for you today, I think we're going to do just a very general relaxation treatment, something really simple, just to give the folks a opportunity to see what this would look like.
Okay. Now, this is a general treatment, not for any specific condition.
This is generally for stress. So this
Stress.
is something that can be used for relaxation purposes.
Okay.
So the needles come in different sizes and lengths. These are a
What
very
determines
small
what
needle.
size it is? I'm glad they're small.
It depends on the person, on their body type. It depends on what I'm trying to accomplish at that time, and different parts of the body also
Okay.
too. You're going to use a different needle. So this is a very, very small needle.
Great.
And
Very happy about that, Joanne.
what I'm going to tell you is that this spot would feel something like if you had a muscle knot and someone touched it, and that little tenderness you might feel.
Yes.
That's the dull type feeling that you may feel, and you may feel it in this finger, but you
Okay.
may feel nothing at all.
Okay.
So I usually have patients take a little deep breath. Good. And that's it.
I actually felt nothing.
Good?
Yes. That was
Excellent.
Good. That was good.
Good, good, good. And we're going to do a matching one over on your other side. Same type thing.
Again, now you'd have a patient lying down in a comfortable
Lying down,
room, proper lighting,
comfortable.
maybe some aromatherapy.
Absolutely.
Okay.
I'm trained to use essential oils on acupuncture points too, so that has a really profound effect if you're using some lavender oil on some relaxation
I
points.
see.
So these needles are going to go in the outer part of your ear. One little pinch on that one.
Okay.
There you go. These are the relaxation points, and they have that little tiny pinch.
Okay.
We're going to do one little one here in your forehead, very mild,
Okay.
and one more in your other ear, just like the other side.
Okay. And how long do you leave these in?
These will stay in normally about 15 to 20 minutes. That's a typical acupuncture treatment.
Okay.
So
All right.
during the treatment, you may feel different things. You may have little sensations around the needle that are not painful. That's your body redirecting that flow of that invisible energy. And it's very hard to describe until you experience it.
Right.
Patients say, I felt that moving down my leg. I don't know what was happening.
So people can get immediate results at times, huh?
Absolutely.
Uh-huh.
For certain things, for example, if someone came in with a migraine headache, often they'll leave with no headache.
Okay.
That's pretty typical for that. Certain conditions take more time.
So I would think that if someone has arthritis and it's complicating the condition, someone has sciatic, for example, comes to our office,
Right.
arthritis is going to take a little bit longer to get a result than someone who may not.
Generally, everyone has a different response time, I find,
Right.
and I need to start working with them a little bit to determine that. Generally, for an injury that's within 3 months, you can allow for about 6 to 10 visits to see a complete change.
6 to 10 visits over how long a period of time would you say?
You can do it weekly or twice a week. If someone's in a lot of pain, I'll have them come in a couple times a week.
Right.
For issues like I work with fertility, you're really looking at about a 3-month course of treatment weekly in order to affect things like egg quality and uterine lining. If someone is trying naturally to get pregnant with no other procedures, you're looking at about 6 months of treatment. That's just because your body needs to readjust that whole cycle, which takes a month in and of itself. So
And for the fertility, you'll actually go to the hospital with the patient. Is that true?
after they're pregnant and they're
Right.
delivering the baby, then I will accompany them to the hospital.
And the
at
MD is
Phelps.
present with you?
Absolutely,
Or-
an MD or a midwife.
Right.
This is a patient request, and Phelps Memorial has been really great about allowing this to come
Is
into
this
the
generally
hospital.
In all the
Generally
hospitals?
not accepted, no. Not in this area. And
Yeah.
Phelps has been really open about that and just wants the patients in the community to have something that they've been asking for. So.
Oh, sure. Okay,
So.
and just you were telling me earlier about a patient. You just were in the hospital with 2 patients yesterday.
Yeah.
What was the scenario there? Tell me.
Actually, I had 2 patients that did great this week. I had a patient who, by the time she had gotten to the hospital, she hadn't even had a contraction yet. She was already 4 centimeters dilated, and she had her baby 2 hours and 40 minutes after her first contraction.
Wow. Okay.
Completely
Happy girl,
natural. Huh? Yep, completely natural. No pain medicine.
Yep.
And the second one went to the hospital at 6 centimeters dilated and had
Right.
just had a few contractions, and we treated her for some back pain during labor, but she also progressed within a couple of hours to delivery. So
Okay.
that was really exciting.
Oh,
And
yeah, sure.
it's fun for me to see someone all the way through
It's a happy time.
trying to conceive to birth.
Sure.
That makes me feel really good. So my patients are often with me for a really long period of time. I get to know them pretty well. So
That's great. And just
Yeah.
in some of your treatment, so the audience understands, you can go to you for if they're having infertility problems, to see if they can conceive and try to help them to conceive, and maybe even treat the husband
right, absolutely.
and the wife together.
Mhm.
And then if they do conceive during the pregnancy, you can then help them get through this a lot easier.
Absolutely.
And have you seen where patients have gone through, because very commonly patients will come to us with back pain or leg pain or sciatic type pain during pregnancy once the lady starts putting on weight, puts stress on
Absolutely.
the back, and we know chiropractically that helps to reduce the pressure, but not all the time and not totally.
Right.
So during that period is where you could also help the patient, is that true?
Absolutely. It works great with chiropractic at that point in time because I am a little limited later in pregnancy on some of the spots that I can do because you
Right.
can't stimulate too much with an acupuncture
Sure.
needle at that time in pregnancy. So while I can work on some things, I think if they're using more than one tool at that time, it really works out well for a patient.
Okay.
And they have very comfortable pregnancies often, very little morning sickness my patients will get. I help with fatigue.
So we'll limit the morning sickness as well?
Absolutely. That's one of the big things. If you come preventatively, it's very difficult to treat that once it's kind of gotten to the point where someone's dehydrated.
Right.
You really need some medical attention at that point. But prior to that, we can work to prevent it,
Right.
which is super.
Right. Key
So
is
how
prevention.
are you feeling?
Very relaxed.
Don't fall asleep on
Wonderful.
me.
Okay, so these are in, and they'll be
They-
staying for about 15 to 20 minutes.
Yeah.
Right.
You would feel like you were able, like you said as you were talking, you could
Yes.
move around a little bit. They're
Right, I'm
not
staying awfully still
painful.
only because I didn't know that.
Yeah, you
Okay.
can absolutely move around. Nothing is
Right.
going to happen. You may feel a little discomfort here and there,
Okay.
but there's nothing that you can do. So during an acupuncture treatment, you don't need to lay perfectly still.
Right.
You don't need to, some patients will bring some music that they really like to listen to.
Sure.
It's very comfortable, and after a few visits, you really will fall right
And how
asleep.
long? It's about 15 to 20 minutes, you said.
15, 20 minutes, but I can take yours out sooner, so
Okay.
that way we can free you up there, and
Okay,
let's see
we can
how you
take them
do.
out.
So coming out, you're basically feeling nothing.
Right.
It's just come right out. Most of the time, acupuncture, you'll have no bleeding. You'll not even tell where I put the needles, so if you take a look,
Would I expect to be sore in the areas that you inserted the needles this evening or tomorrow?
no.
No.
Not for this type of treatment. Occasionally, if you're treating a muscle pain,
Right.
you will later on feel like if you had a good massage in there,
Right, yep.
but it's a therapeutic soreness that will pass within the evening, and generally the next day you'll wake up feeling a lot better.
Talk to me
So.
about stopping smoking, weight loss. I know a lot of people go to acupuncturists for that.
Absolutely. For both those situations, it's really dependent upon the person and what they're looking to accomplish. It's a definite help in both cases, but it needs to be combined with some other sort of either, smoking like a mental attitude of I'm definitely breaking this habit. If I need to
Right.
change my morning cup of coffee to a morning cup of tea, then that's what I'm going
Yes.
to do.
Okay.
But it will take away cravings, it will eliminate withdrawal symptoms, and it can definitely speed up the process. For weight loss, if you're working on metabolism, it's really something that takes a long time to adjust because that's a lifetime constitutional pattern in the
Sure.
body.
Sure.
But if it's for cravings of specific things like sweets or salty things or
Right.
chocolate,
Right.
we can really help with that pretty quick.
Okay.
So if someone's working on a dietary plan, that can help them
So they
accomplish
can go
that.
to their nutritionist and have a diet prepared for them, and you think, or you have had patients who have had better success also having acupuncture with the nutritional weight loss program.
Absolutely.
Yep.
Absolutely. It helps you stick to your program a little bit better.
Great.
And I mean, the basis of all these treatments is giving your body the tools it needs to feel better.
Right.
And so that's why I have patients put their focus on being healthy. So
Right.
when you're trying to get pregnant, it can be a really emotional process in particular.
Sure.
In any chronic disease,
Mhm.
it can be emotional. Fibromyalgia is a very emotional condition.
Sure.
It's draining.
Mhm.
And so I have patients focus on each day, what can I do to be as healthy as I can?
Right.
And whether that means taking herbal medicine, changing what you're eating,
Mhm.
changing your lifestyle or exercise pattern, using acupuncture, whatever it is that we can give your body the tools for to help you feel better and go out there
Right.
and do the other things.
Yes.
And acupuncture patients don't regress. Once you kind of get to a certain point,
Right.
unless there's a new factor that comes into your life,
Mhm.
you will stay there. Your body figures out how to keep it in
So
balance.
those meridians get balanced, and it's not something you have to continually go back for unless you go out of balance for some reason.
Absolutely.
Okay.
Some people like to come for maintenance just because it feels good,
Yeah,
and
sure.
it's good to keep your immune system up. But
Right.
if you had a specific injury, that should be resolved after a course of treatment and not require a lifetime of maintenance.
Well, that's great information,
Yeah.
Jill. Hey, Jill, I want to thank you for being on the show today.
Thank you so much
It's
for having me.
Very informative and
Great.
very pleasurable to be with
Great.
you. This is Healthy Frontiers. I'm Dr. Bizzoni. If you have any questions for myself or for Jill Schwartz, who practices here in Westchester, please email us on the website, and we look forward to seeing you on the next show. Thanks for being so attentive. Thank you.